Welcome to Medically Speaking. Our guests today are Ian Barrett and Hinata Filarecki, Kaleida Health's Human Resource Department. Thanks for joining us today, guys.
Thanks for having us, Mike.
We want to start with recruitment and hiring. Obviously, significant issue for every industry, but in particular, healthcare has been impacted during COVID and post-COVID. If you can you talk a little bit about what you guys are handling now with Kaleida coming out of COVID when it comes to recruitment and retention of staff?
Sure, Mike, thank you. So yes, people are the core of what we do in healthcare. We can't provide high quality and safe healthcare without great people. And so we continue to focus on recruitment. So we'll talk a little bit about a job fair that we'll be having, but we continue to recruit for great people in all roles at all locations. And so we have a dynamic talent acquisition team that's out recruiting. From a retention perspective, we know that people want a couple things. They want strong leadership. They want a strong culture. They want recognition. And so we're focused on those as we create the perfect environment or a great environment for people to both receive care and also to deliver care.
Yeah, so both of you are relatively new to the organization. If you can, if someone may be interested or watching this or at the job fair, they may be interested in joining Kaleida Health, and whether they're local or relocating, what attracted you guys in particular to Kaleida Health, or what have you found, since you joined here? Hannah, I'll ask you to go first.
Thank you, Mike. So Kaleida Health to me, is an organization that offers so much to their employees as well as the patients. We are a workforce that is centered around patients, and we have so many people that are kind and compassionate. And when I learned about Kaleida Health, I wanted to be part of an organization that is like that, respectful, and that really excels in everything that we do. And not to mention all the benefits as well. And so we do have a very generous benefits package that we can talk about in a little bit, but those are some of the things that really attracted me to Kaleida Health.
Ian, how about you?
Yeah, great question. So I've been in healthcare a long time. And so when I got the call to consider coming to Kaleida Health, I was thrilled. Kaleida Health is the leader in providing healthcare to people in Western New York. People trust us. We provide high quality and safe care, and we live our values that Nada mentioned earlier. We have a strong reputation. We do a good job. We're certainly not perfect, and we own it when we're not perfect, but we're a trusted healthcare provider for the people of Western New York, and I'm thrilled to be a part of the team.
That's great. And Ian, you talked about, you've been in healthcare for a while. Both you and Hinata have had the benefit of working at other companies, maybe even other industries. Let's stick with you and ask you, what have you seen by working in other industries or other locations that can, when you look at it from a comparison standpoint, the benefits we have here at Kaleida Health?
So I think we do have some great benefits. Hinata mentioned them earlier. So everything from, health insurance and dental, flexible spending, disability, basic life, other types of life insurance, accidental death, various savings programs, a pension program, which is really unheard of these days. And then people at Kaleida work hard, but we play hard as well. And so we have a generous PTO package. So I think that our benefits package is competitive with what I've seen. And so not only is it wages, but it's also about benefits, and we have a really good one.
Hinata, let's get into some of the specifics in terms of what you guys are doing for recruitment and who you're looking for. What's the top need for Kaleida Health or for healthcare? And what are you offering in those types of roles?
Absolutely. So the number one talent that we're seeking right now would be registered nurses. We have so many great opportunities for telemetry nurses, for long-term care nurses, you name it, we have it. We're looking for environmental services aides as well, CMAs, which are certified medical assistants. We're looking for certified nursing assistants. And in addition to that, we also have many non-clinical positions available. And so we're so excited to, be able to open this job fair up to the public at Highmark Stadium, and where we're going to offer interviews on the spot. as well.
Yeah, so let's talk a little bit more about that. Kaleida Health has a relationship with the Buffalo Bills, the official healthcare provider, and oftentimes you'll see advertising throughout the games and things like this. But this job fair is something unique and something we haven't done before. So if you can, why Highmark? Why the stadium? What's the benefit of doing something like this with the Bills?
So in partnership with the Bills, we decided to do the job fair there to, really support the community, support the Bills, right? Support Kaleida, and how better to do so than at the stadium. And so with that, we will be offering tours of the facilities, and I had mentioned the interviews as well. And so it's going to be a fun day. It's going to be a great opportunity for people who want to get to know Kaleida as an employer a little bit more. Anybody that wants to explore the careers that we've available, we have such a wonderful plethora of opportunities to offer, right? And so I'm so excited to showcase that to anybody that comes in. We will also have resumes, workshops. And so if anybody that needs just a little bit of help with that, we will be there to help them as well.
So in a sense, this is an opportunity for Kaleida to bring potential employees essentially to the Bills, both in an informal and formal way, meaning you get a chance to see the stadium, you can tour, the stadium, but also you get the feel of what it's like to be out there. And you only get that benefit because that's Kaleida Health's relationship. So this is one of those kind of perks of being a Kaleida Health employee. Is that right, Ian?
I agree. Yeah, as an official healthcare provider for the Bills and in our partnership, this is a unique opportunity. And so we're excited to be able to present this opportunity to people across Western New York to come and check us out, check out careers with us. And at the same time, also to have fun at Highmark Stadium. People also have an opportunity to win a pair of tickets to the October 15th game. And so we hope that Kaleida Health, our reputation, the Bills' reputation and their winning record, winning yesterday. And we hope that all of that excitement will get people out on October 4th to come visit with us.
So Hinata, I know that you guys have worked hard on this in terms of all types of logistics, but in particular, transportation. Not everybody has access to a car, or they may share a car with family members. Tell us what you're doing for those who might have trouble getting to the stadium for this event.
Yes, thank you, Mike. So we partnered with NFTA to provide a free day pass to anybody that wants to join us at the job fair on Wednesday, October 4th, between noon and 7 p.m. And so we really want to make sure that anybody that wants to come and see us, that they have the opportunity to do so. And so in addition to the free bus pass, we're also doing free parking.
Well, exciting, very unique type of job fair, but again, gives the opportunity to bring the community a little bit closer to the Bills, understand Kaleida Health a little bit better, and more importantly, find a potential career with us. So for the viewers who are watching this or may have heard a radio spot or seen something on TV, where can they learn more and how do you register?
Yes, so anybody can register if they go to kaleidahealth.org/job fair.
That's great. Well, that's Hinata Filarecki and Ian Baer of Kaleida Health's Human Resources Department talking about the big job fair coming up on October 4th. Guys, thanks for joining us today.
Thanks for having us, Mike.